You know, it's no secret that COVID-19 has put a strain on our healthcare systems across the nation. And one of the biggest challenges has been finding beds for COVID-19 and non-COVID patients.
And unfortunately, Stillwater Medical has experienced that firsthand. News 9's Erica Rankin has their story.
Stillwater medical health leaders say in some instances they would call dozens of hospitals in the state, sometimes even calling ones in other states like Arkansas or Texas to find a bed for a patient. When those beds aren't found, sadly, sometimes that means a life is lost.
Those situations occurred all across Oklahoma when we did not have the ability to transfer patients from rural hospitals that didn't have the capability of doing procedures that needed to be done on those patients.
Dr. Woody Jenkins, an internal medicine physician at Stillwater Medical, says in one instance they called dozens of hospitals to find a critical care bed for a patient. That effort eventually failed, and tragically, that patient died.
It was very common that all across Oklahoma we were transferring people all over the country.
He says those situations are hitting nurses hard.
A floor nurse that had took a leave of absence for a while because of COVID and the strain, and she was having flashbacks of people suffocating.
Since the beginning of the year, Stillwater Medical has lost 50 nurses, and their registered nurse turnover is over 20%. He says once the pandemic is behind us, it will be a long road to recovery for healthcare workers.
They have learned more than they've ever wanted to about ventilators, COVID, and how to use a body bag.
Dr. Jenkins says good news for their hospital. They have seen admissions into the hospital come down in the past couple of weeks, and he hopes that trend continues. In the newsroom, Erica Rankin, Oklahoma's Own News 9.